Let's talk about antiemetics. Antiemetics are all excentrally in chemoreceptor trigger zone of the area postrema. We have the drug ondansetron, granisetron. They work on the serotonin receptor antagonism, also act peripherally by decreasing vagal stimulation. Clinical use is nausea, vomiting after chemotherapy, radiotherapy, or surgery. So, adverse effect is headache, constipation, QT interval prolongation, serotonin syndrome. Okay. Then you have the prochlorperazine or metoclopramide. This is a D2 receptor antagonist, while the metoclopramide also causes increase in gastric emptying by causing stimulation and increases aldosterone. So we also give this metoclopramide in diabetic gastroparesis. I mean, they must have mentioned here. Clinical use, where is it? Gastroparesis and diabetes, right there. And we did talk about this in physiology. Gastroparesis, diabetic gastroparesis. We're causing increase in the gastric emptying, increase in motility by giving metoclopramide, which is a D2 receptor antagonist. Adverse effect, clinical use, nausea. Clinical uses, you can give it in vomiting. Metoclopramide is also used in gastroparesis and persistent GERD. Adverse effect is a really thing that you don't give this thing. That's the extrapyramidal side symptoms, and also causes hyperprolactinemia by inhibiting that D2 receptor. Anxiety, drowsiness, restlessness, depression, and GI distress. Aprepitant and fosaprepitants, they are the NK1, neurokinin 1 receptor antagonist. And neurokinin 1 receptor equals substance P receptor. So they are you can use them in the in chemo-induced nausea and vomiting. Fatigue and GI distress is the adverse effect. Okay. And these are pretty much it for the antiemetics, and they're all, now mention again, these all are working in the CTZ, chemoreceptor trigger zone of area postrema, and all of them are antagonists. Antagonist, all of them are antagonists, and they're all antiemetics.